COVID has reactivated my EBV. My numbers are extremely high for a year now. So along with all the other long COVID issues I'm dealing with, what is the best way to get the EBV to go latent again?
I'd want to look at what other infections you might have. Is it just EBV? It's usually not just one infection that's been reactivated. It's usually many. And maybe you've had them all evaluated for. I'd want to modulate your immune system first. I don't know you though. So in general, I probably want to modulate the immune system and then maybe use some, when the time is right, in the right person, if necessary, use some herbs, maybe medications to work to kill off, to have some antiviral action against the Epstein Barr virus if it is indeed active.
Yeah, because this is one of the great questions with EBV. First of all, I want to mention, when you say one of the things that Dr. Parpia has taught me over the years is how important it is to use peptides to quiet inflammation, to get that immune system to be more in a healing mode than in just an angry mode. But, and again, as far as EBV, this has been an issue for, I said, they've been chasing it for 40 years as far as chronic fatigue. And there was a Dr. Lerner in the late 90s till about 2010. I think he was in Detroit. I was an infectious disease doctor who did a very large series of treating people with high EBV titers with very high doses of regular antivirals. And he had when I looked at his data, I put it like 30% of people had a dramatic response. About another 30% had a so-so response, and the other 30% didn't do much of anything. And anyway, and I've seen that same thing over the years. So, and I do believe that it's because a lot of the people who didn't have any response, they also have tick-borne disease or significant toxin load along with it. Because it's not so much that usually the Epstein Barr is not reproducing that much, though it can be, but more likely it's just the B cells that have the Epstein Barr in them living are being activated and made to reproduce a lot. So your immune system keeps seeing a signal of EBV, and that makes a lot of these antibodies, and it also just continues to push the inflammatory cycle in your body. So I know this is a bit of a long answer, but I'm just saying it's worth exploring, but look for other things. It's not just.
Yeah, we don't know if that Epstein Barr virus or the other viruses really are activated in you, if it's just your immune system seeing pieces of the virus, thinking it needs to fight it, but it doesn't. So there's a lot to explore in order to really understand, is this really reactivated? If it is, what else that was dormant has been reactivated? What state is your immune system in? Is it in a hyperactive state? Is it in a slower state? Likely both. So these are the things I'd want to explore.
And just one quickie a takeaway that you might use is ask your doctor to run. There's a lab called Infecto Lab. It's a great name. It's a German lab, Infecto, just like it sounds, Infecto Lab. And they have an EBV, an Epstein Barr. It's a T cell test rather than just the antibodies, which are from B cells. And if this T cell test is extraordinarily elevated as well, it has a stronger chance that it's really reactivated, because I'm sure the doctor probably has checked the PCR, and that may or may not be positive. But adding in the T cell information would be helpful.